I'd like to welcome everyone. Hello to all of you guys. This is the second time that we are doing a revisional bariatric surgery webinar. And we did one last year and it was very successful. So we are going to do this more often. I'm expecting Dr. Rodriguez to join us from our hospital, Azar in Tijuana. So just we still going to do a $2,000 off of surgery package. We're going to do a raffle at the end. Please make sure you do have a health questionnaire filled out in our system. Even if you have done it before, you don't have to resubmit it unless it's over 6 months old. And this raffle is going to be for Dr. Christian Rodriguez specifically. I'm going to release the Zoom poll at maybe around 11 o'clock. Make sure you're attending all the way to the end. And that's one of the requirements to have a health questionnaire, be eligible for the surgeries that Dr. Rodriguez offers, and we will do the raffle at the end, and we will do a $2,000 off a surgery package. Just a little bit about me. I'm the founder and director of Mexico Bariatric Center. I've been in the industry since 2007, and I started MBC in 2012. Mexico Bariatric Center has been a well-known name in this space, and we've had really good success since inception. And you'll see more about what we do and why you choose us, and we will talk about different type of surgeries. We would try to cover as much of your commonly asked questions during our presentation. However, if you didn't hear your answer or your answer is a specific, you can ask it in the Q&A tab. We will try today to make the presentation shorter so we can get to your specific questions. If you did not hear the questions answered you can circle back and ask us from your coordinator or call our office. So the topics we're going to cover today, it's going to be basically about revisional bariatric surgery. And basically, we're going to cover undesirable bariatric procedures. And we would see what are the options for patients who have received the first or initial procedure and they haven't been successful. We'll talk a little bit about our nutritional support program, Nutrition Plus. And then Dr. Rodriguez is going to take over and talk about all the endo, lapro, revisional surgeries. And we would, during the presentation, also would present to you some of the key statistics and success rates of past patients who have received or looking into getting a revision or conversion. We would talk about why MBC, Mexico Bariatric Center, and the support programs that we offer, including our vitamin specific for bariatric patients. basically a little bit about financing, and then we would do the Zoom poll at 11, like I said, and we open up for Q&A session. We would see some of the revisional success stories, and that's pretty much the outline of our today's presentation. So we talk about undesirable bariatric procedure outcomes. So there are several reasons that patients who have received a bariatric procedure looking to either revise it or convert it. One is very simple, is not getting to your goal weight, or you did and you gained it back. So weight regain or not insufficient weight loss. And then there are other reasons, like if you had complications from the first procedure, like, like GERD or acid reflux, or you got some obstruction or gastric band erosion, for example. We see that a lot. Or stricture, which is very rare, but these are possibilities that may require a revision to your surgery. And then there are some that very small portion that they either lose too much weight or they have nutritional deficiencies. And those are also reasons for basically looking to changing the initial procedure that you received. In general, if you don't reach your goal weight, it could be so many reasons like genetics, age, if you have diabetes, hypertension, depression, life events, right? We talked about weight regain. There are some events in life that, take us back to our previous weight, and also the starting BMI, like preoperative BMI, the diet, of course. Again, this is a tool that you acquire. You need to have the right diet and right activity level. Having a active lifestyle is huge. And then if you have had previous abdominal surgery, and making sure that you receive the first procedure that is best for you. That is huge. We see that often that the surgeon or the company that offers these procedures, they don't offer a complete spectrum of procedures, so they're limited to what they can offer. So they only want to do sleeve or a bypass on a low BMI. So that's you have to make sure your initial surgery is best for you. And go with a company that can offer you all the different procedures so you're not limited. And believe it or not, the surgeon's skills. How good they are and how much experience they have. And sometimes there are surgeons that they are just the face of the company, but they're not the one doing the surgeries. So these are all factored in. So that's why you have to do your due diligence. When we did, I promised to show you statistics, and when we did our survey, 74% of patients who are going through revision or conversion had insufficient weight loss or weight regain. 14% was complications, and about 12% had a combination of insufficient weight loss or weight regain. But if you want to look at it in a general number, to make it round off, is like 80% of people did it because of insufficient, not reaching their goal weight, and about 20% complication. A little bit about goal weight, right? It's very simple. The BMI is a number that you plug in your height and weight and give you a number. But it doesn't consider your frame size. It doesn't consider your shape. So there's all those factors. But, you know, like your waist circumference diameter is important, as well as what condition you are, right? If we go up the stairs and we are breathless, that is a metabolic problem, right? So, but in general, this table gives you an idea of, based on your height and your sex and your frame size, where you need to be. Of course, your goal weight could be different from your ideal weight. Some people like to be more skinny or less skinny. So what you do is you find your ideal weight from this chart. So let's say I weigh 300 pounds and my ideal weight is 200. So I have about 100 pounds extra, right? And as you see, hello, Dr. Rodriguez, welcome.
Hi, how are you? Hello, everyone. Thank
Great.
you for having this webinar with us.
Yes, it's exciting because I was just mentioning that the first time we had this was so successful that we decided to offer it more.
Nice,
I
nice.
appreciate you taking your time and joining.
Good morning. Good morning.
So any type of surgery, you look in the literature and they tell you, oh, like for gastric sleeve, you need to lose, well, you lose 65%, for example, the first year. So your excess weight, where you see percent excess weight, basically is saying, okay, if I have 100 pounds extra, I'm going to lose 65% of it, which is 65 pounds. So your weight after weight loss surgery is going to be 235. But again, that 65% is only in the literature. It depends how you work with your tool and how much active you stay and what diet you do. And so we see patients that they lose 100% of their excess weight. So if they are 300 and they need to reach 200, they lose 100 pounds. We've seen patients that lose 150 pounds from 300 to reach their goal. So it's not limited to the 65% or 75% or 85%, okay? Again, you know, we talked about BMI. So again, diet, physical activity, life events, lack of sleep, things are like that. Stress is huge. And underlying medical conditions are factors of how much you lose and do you reach to your goal weight. So here's a pyramid that we can see post-bariatric patients, the effectiveness of different tools that you can use to go back to your goal weight. So like, let's say pouch reset for gastric sleeve, right? Because you have the tool, you can always use your tool to go back and lose more weight. So nutrition, exercise, things like that is effective, but not for everybody. And then some patients, post-bariatric patients, do well with using GLP-1 medications like Ozempic-like type of medication. But again, it's not for everybody. So now we go to the ultimate, which is bariatric revisional surgery. And those could be endoscopic or laparoscopic, which Dr. Rodriguez is going to explain. Now here's another key statistics that I promised you. So in the literature, you see that 15% of patients who received initial procedure need a revision. We see that in our center with our patients, only 5% require revision. So again, the numbers you see or you read, it's average or it's the patients in US. But again, the type of surgery you get the first time, is it suitable for you? And the surgeon who does this expertise also counts, and the support. So here we go. We have only 5%. So one of the support systems that we have nutritionists in our staff that they're expert in providing support for you pre-op and post-op. And again, we do offer bariatric vitamins that are specific for post-bariatric patients. This is crucial to take for long-term success. And we do offer what we call a nutrition support plus. And those even more come with more support, right? With the video library, with the live webinars, the food logs, all that stuff, right? So we talked about tools like pouch reset, the 5-day or 10-day pouch reset. If you're a gastric sleeve patient, you can always do this to see if you can go back down, because again, you already have the tool. And then we talk about Ozempic like Manjaro, Wegovy, all those medications that imitate that because it gives you the GLP-1 or GIP hormones, and you already have the restriction, right? So that could work for get you down to your ideal weight. But then again, if you do this long term, the side effects or complications could be devastating. And also, we just saw a published study that about 60% of patients who start with Ozempic, they quit before 12 weeks because of the gastro, problems with diarrhea and all the other complications and the cost of using Ozempic on a long-term basis. So now we come to the ultimate tool, which is bariatric revisional surgery. Again, this is even more important now to go to a company that can offer you the best modification to your original procedure. Because it's funny that I see like some companies or some surgeons offer revision and all they can do is a sleeve or bypass. Even on the bypass, they're limited. So imagine, again, you're going to get the second time a surgery that is not good for you. And that's what the expertise of our surgeons come, like Dr. Rodriguez. He's a super surgeon. He could do pretty much anything, including reversal of your first surgery. And that's what you want to look into, a company that can do that. I've seen like even in US, there are some surgeons that are very limited in what they can do, and they offer revisional surgeries. I think that is not doing, that's not fair to the patients, because you need to go to a place that they can offer you a wide range of services and they can do the best for your situation. Again, I show you some key statistics, and this is one of them. So these are the type of revisional surgeries we offered last year. So as you see, the majority of them was gastric sleeve to RNY bypass, about 28%. We still have a lot of lap band revisions that we convert to sleeve, 19% of those. A lot of gastric sleeve to mini bypass. That's a really good option too. And then the RNY gastric bypass revision, which is one of the advantages of getting sleeve, if it's a good option for you, that is easily convertible. Bypass is a different story. We did sleeve to duodenal switch, about 7%. Imagine if a company can't offer you duodenal switch. So they're going to give you a bypass or mini bypass. But 7% of patients really needed to go to DS. And again, still some more lap band, some fundoplication, sleeve to SADI, that's another 3%. So about 10% of patients got sleeve to DS or SADI. And then we did a very small revision of a sleeve, which is we call re-sleeve, lap band to duodenal switch. And we've done some RNY gastric bypass to DS, which is less than 1%, but still, that's a, and if you read the statistics in the 15-year mark, the DS has the most effective outcome comparing to bypass. So that's why you need to go to a center that can offer you DS and all different procedures. So 1 year out from the procedure, 41% of people lost more than 60 pounds, and as you see in this chart. And a very small portion lost about 20 or less pounds. So a lot of people lost quite a bit of weight. You have to remember the second surgery, it may not be as effective as the first one, and it comes with a higher risk, okay? And this is the amount of weight they lost in 1 year. They lost band to sleeve 57. These are average, of course. Band to RNY gastric bypass 100. Sleeve to RNY 79. Sleeve to mini 58. RNY gastric bypass revision 49. Which we tell the patients who have RNY gastric bypass is not going to be effective, but as you see, they still use considerable amount of weight, again, because we give them the right revision for their bypass, and our surgeons are expert in doing that. And of course, balloon to sleeve is huge, 85. And these are the percentages, The side effects, dehydration, vomiting, constipation, bloating, diarrhea, hair loss, and fatigue, and gas. So these are the highest is fatigue. These are the side effects of revisional surgeries. We had a survey from our patients that what is their satisfaction, and over 50% gave us 5-star. Overall, they gave us 4.2 out of 5. Again, I talked about MBC. We are a US corporation that we do coordinating with our surgeons and our hospital in Mexico. And we send patients. We basically give you peace of mind, and the services we offer are untouchable. Even CDC recommends companies like MBC to work with because we do everything for you, from hotel reservation to airport pickup to drop off to medication to matching you with the best surgeon for you. Right now, we're working with 5 teams of qualified surgeons in Mexico, in Tijuana, and Guadalajara. And we've done easily over 25,000 successful surgeries. Now, since we started publishing these numbers, because no company can reach these numbers, they started, other surgeons or companies started putting some fake numbers up, and you just want to make sure these numbers are correct. They're just not saying, oh, I've done over 10,000 surgeries. Again, why choose MBC? Top board certified surgeons, the years we've been in the industry, our reviews, we have over 850 five-star reviews, and we didn't buy them. We are having Persians, they actually review us on their own. Again, there is a difference between a team of experienced bariatric surgeons and a standalone surgeon that could be just started doing his or her surgeries because they were assistant surgeon before. It's like a pilot with very limited amount of flight time versus a pilot who has done thousands of hours of flight. And most of the time, there's no problem. But when the problem comes, you need to have that experienced pilot to save your life. And that's what you need to do when you look to get this surgery, especially revisional. Now is a whole different ballgame. So these are the highlights of why you need to choose us. The range of surgeries we offer, the complication rates, and then we publish our complication rates, and is less than 1%, is less than 0.7% of, which is less than 1%. And this is including all our first surgeries and the revisional and conversion surgeries. If you count that, you see, including the cases that we take, that is extremely low. And one of the reasons is the system that we have developed over time. We have complex algorithms that match you with the best surgeons in our team. Our surgeon liaison is first matching, looking at this match, making sure it's done right, and then she's involved in the reviewing and approval process. So the surgeon reviews it, goes back to the surgeon liaison again, and she makes sure it's done right. There's no, everything matches. It tells, like, for example, the medication you guys need to start or stop based on the recommendation of the doctor, and she's involved in every HQ that comes through our system. So, because a lot of patients say, oh, I need to talk to the surgeon. If you do your health questionnaire complete, you talk to the surgeon, of course, before surgery, and we started doing some lives. So the surgeon would go, we rotate them every Wednesday and Saturday. When we don't have the webinar, of course, they will go for half hour. You can ask them questions, but that's the system we have. Okay, so we started this project for our hospital. In 2021. They were too young, they don't know what to think about it. That's what we said. 16th of September, lying in my bed. I'll wait forever. It's never too late. Couple thousand miles, it's just a little space. Yeah, so we successfully opened September of 24, and this dream of MBC came through that we are now um, doing the hospital part, and we have control over our own services in Mexico. This hospital, Azar, which we call in memory of my mother, that has 4 ORs, fully equipped. Everything equipment in this place is the state of the art, one of the best, and is top 3 center in Tijuana right now. Of course, remember, this is not a walk-in hospital, is built and designed, fully accredited around patients who receive bariatric and plastic surgeries. That's why it makes it so specialized and so well built for medical tourists, of course. Um, um, so now, since January, we started allowing companions to stay with the patients in the hospital. Of course, they get a recliner, but they still have option to stay in Hyatt. Um, the first night, of course, they are with the patient, and the patient goes to the hospital. They can go back and visit from 7 a.m. to 7 p.m. But that's exciting also. Our process to approve you, again, is very simple. You fill out a health questionnaire. We match you with the best surgeon, and for you, you get the approval. You can actually book yourself online. You don't need a coordinator, and then of course the coordinator going to reach out to you and get everything set up. And you book your flight, or if you're driving, you do all that part. You do the you know you tell us your flight information, or you're driving, all that with the coordinator. So our packages are all inclusive. You get, you don't have to worry about the hospital reservation, all that, the nutritional support, transportation, of course, the surgeon fees, the hospital fees. It comes with a standard pre-op, post-op tests and medications. And we offer what we call a medical tourism insurance. That's optional, but is deeply discounted. It's over 50% off. So I make sure please to take advantage of this offer. We also have a great support groups, and our main support group, which is our past patients, are over 13,000 patients. And we do a lot of events, like I said, for Surgeon Lives. So which is going to be Wednesday, Saturday, 10 to 10:30 Pacific time, coordinated lives, webinars, nutritional webinars. We do have a lot going on, so you can jump on. And our past patients are with us to support us. Jamie, Rena, Sarita. Sarita is more involved in our Facebook groups. Kelly, Tiffany, and Laura. These are the team that's supporting us day to day. We do have a podcast that Sarita and Rena do together. I recommend you guys jump on that. So again, for people who joined a little later, to take advantage of a $2,000 off of Raffle at the end of the webinar, you need to have a health questionnaire in our system. If you haven't filled out one, please go ahead and do it. I'm going to release the Zoom poll around 11 o'clock. Of course, these are Pacific time. And please watch the webinar to the end, and we do the raffle. Again, we talked about the exclusive network of our bariatric surgeons. These are standalone teams. Sometimes you see companies that they show multiple surgeons, but they're all really one team. This is separate teams, separate expertise, separate experience comes together in one place. Like Dr. Usuna, I work with her since 2010. 14 years that she's been only working with me. Imagine the amount of expertise these surgeons have. Dr. Rodriguez, which is present today, he's our super surgeon. Dr. Miguel Montalvo, he's one of our top gastric sleeve specialists. Dr. Gutierrez is our chief surgeon. And Dr. Jesus Sea is one of the well-respected surgeons. So for the hotel, most of the time we use Hyatt Place, which is #1 hotel in Tijuana right now. Very nice and very hard to get into. Please stop any blood thinner or NSAIDs 1 week before surgery. If you're taking Ozempic, stop 3 weeks before. No smoking before, after. Again, the better job you do on the pre-op, the better job you do on these things, the better outcome you have. Make sure just bring the empty bottles with you. Then if you're taking some medications on a regular basis, we want you to show up before 12 noon and your departure time be 2 p.m. on the day you take off. On the day you arrive, you either stay in the hospital or you stay in the hotel. We do all the pre-ops. You get broth, jello, ice chips. Your companion gets free breakfast if your companion stays in the hotel, of course. On the day of surgery, if you're in the hospital, no problem. You go, they take you to the surgery room. If you are not, we transfer you from the hotel to the hospital. Hyatt is few blocks only away from our hospital, so it's very close. Your companion can even walk. Of course, be very careful. You stay 1 night, 2 nights, or 3 nights based on the procedure you get. We do all the post-op, pre-op tests and multiple leak tests. It's the staff in the hospital, they're amazing. The nurses, the staff that they're running it. One of the success rates that I mentioned, our complication rates are less than 1% is because we manage the surgeons load on a daily basis, and we don't load them one day and not have anything to do with them next day. So they all have even load every day. Doctor, so actually that's a good point. When you go there, there's so many people. But remember that these people all divide between 5 team of surgeons. And so we usually don't have more than 4 surgeries per surgeon a day. Now we get Dr. Rodriguez. I don't need to introduce him. He's a well-known figure in his field. He's been a presenter and one of the instructors for other surgeons. And actually, I let him talk about his accomplishment recently. He's been invited to actually lecture surgeons in United States, right, Dr. Rodriguez?
Yes, that's right.
You
We
can,
are really
yeah.
happy to be part of the education in weight loss surgery. We have many experience. We have many successful cases here in Mexico Bariatric Center in our company. We have really complex procedures. We do all the high BMI cases. We do a lot of hard, difficult cases when the obesity is severe. So we are proud to tell you that we are doing the things that it's supposed to be. We are in the top level of weight loss surgery. Uh, we are helping a lot of patients. We are improving the quality of life of we love what we do. So this is the results of many years of working. So now with our new hospital, with a lot of that we have, so I believe this is something really important for our company, or for the patients, because when we do the things right, we're gonna have good results, and that's something really important. I need to tell you that in Mexico, here in Tijuana, it is a mix of a United States company with a lot of experience, nurses, surgeons. So you need to see our hospital, right, Ron? And you will see the top
Yeah.
level that we have. The
Yes.
last week, we have visitors from United States, and they say that our hospital is you need to see the hospital is it's beautiful. We have all the technology, everything that our patients needs is going to be there, and also the expertise of the of nurses, surgeons, everybody, our expertise doing this. So
Yeah, we really appreciate you being on our team. It's really a pleasure to have you. I'm gonna let you take over and talk about maybe different types of procedures we offer, and then talk about individual procedures. Thank
yes, uh, everybody needs a different tool. When a weight loss surgeon tells you that you need a only they you only need a gastric sleeve, be careful, because uh, there are several options, and everybody's different. We have laparoscopic techniques and endoscopic techniques, and to see what is the best option for you, we need to know uh, your health history. We need to understand what is going on. So that is the only way we can give you the best tool for you. We can do laparoscopic, endoscopic, and we can do all the weight loss procedures, because we understand that every patient is a unique patient, and we need to do what he deserves and also what he needs. So we can go from the gastric sleeve. We know how to do the Aaron White gastric bypass. Also, we have the endoscopic, like the novel procedure that is ESG, endoscopic gastroplasty, better known that gastric sleeve, endoscopic gastric sleeve. And also, we have the duodenal switch, the traditional or the novel duodenal switch, that is the CDS. The CDS, I need to tell you that we are the number one group in the world with more expertise in this year, in 2025, in the meeting, bariatric meeting. I am invited to be part of the we're going to do a book. We're gonna tell everybody how is the best way to do a duodenal switch, and I'm gonna be the in that part of the book. So you will have the best surgeons for you, and if you need a duodenal switch, here is the best place to do it. We have many patients, and also we have all the records. So that is why we are top one in the world in all procedures, but taking in duodenal switch, we are the best. Also, we have a lot of experience in revisional surgery. The revisional surgery is not for all the surgeons. You have to be really, you need to have a lot of experience to be able to perform safety revisional surgery. We can convert from gastric sleeve to Aaron White gastric bypass. We can go to gastric sleeve to duodenal switch. We can go to lapband, to sleeve, to Aaron White, to duodenal switch. We can do reversal, and also we can do Aaron White to duodenal switch. We do all the revisional procedures. We have the best expertise here in probably in all Latin America. We are number one in revisional surgery. We can mix laparoscopic with endoscopic, we can do both procedure in the same patient. So revisional procedures, uh, you must be really careful to choose your surgeon. It has to be a high level expertise, and here in Mexico Bariatric Center, you will find all the expertise that you deserve. So one of the gastric band. The gastric band was really popular in 2000s, probably from 2000s to 2010. There are a lot of patients with lat band. The lat band is a foreign body. It is a plastic ring that is in your stomach, from the outside of your stomach. And a lot of patients are having a lot of issues with lat band and also with regain. They can have acid reflux. They have regain of weight. So we can remove the lat band and make a conversion to gastric sleeve, RNY, or duodenal switch. The most important part in after lat band is acid reflux. If you have acid reflux, the best option is gonna be the RNY gastric bypass, because the RNY improves acid reflux. Uh, this not happens with the gastric sleeve or duodenal switch, but if you don't have acid reflux, and if you have a really smooth conversion of the gastric band, we can do a sleeve or duodenal switch. But the lat band it was a procedure that nobody. There's some surgeons doing lat band, but lat band is gonna be part of the history. Nobody's doing lat band anymore, and we are removing a lot of bands, and we have a lot of experience also removing bands. Probably we remove 2 lat bands per week. So yes, we have a lot of experience. The sleeve gastrectomy, the gastric sleeve, is the most popular weight loss surgery at this moment. It represents the 70% of the surgeries weight loss surgeries in the world. So we have a lot of gastric sleeve patients. Uh, you need to you have to do a really good gastric lift technique. You must have a really gastric lift technique as a surgeon to don't have complications. Also, patients can have weight regain, and we need to do a re-sleep. When the sleep gets stretched of the, or if the sleep doesn't have a good technique, anatomic technique, we can re-sleep uh, the previous surgery. The success rate is not too high. Sometimes it's better to convert a sleeve to another procedure, like a RNY gastric bypass or duodenal switch. But sometimes it could be an option when anatomy um, is not okay from the previous surgery. So it's going to be a finding. But yes, we can do the sleeve. We can do it with endoscopy, or we can do it with laparoscopy. Endoscopy, I like it because there's no incisions. It's only a 30, 40 minutes procedure time. Um, we can shrink the sleeve from the inside with not absorbable suture. But if you need to lose a lot of weight, probably the best option is gonna be a conversion to from sleeve to RNY or duodenal switch. And this is the gastric sleeve to MRY gastric bypass. When 15 or 20% of patients with gastric sleeve can have acid reflux, GERD symptoms. The best option is to do a conversion to MRY gastric bypass, because the reconnection of the small bowel in the stomach is gonna help you with the pressure of the intergastric pressures, and it's gonna relieve the acid reflux symptoms. And also, we're gonna lose more weight. So A previous patient with acid reflux and weight regain, the best option is going to be the gastric bypass. Results, successful results, is gonna be around 40%, and also it's gonna improve the acid reflux symptoms. So right now, the MRY gastric bypass is the gold standard in weight loss surgery, and is gonna be a good option in revisional. The best option when you have a lot of regain or you need to lose a lot of weight after gastric sleeve is going to be the duodenal switch. The duodenal switch is number one in weight loss, is number one in control of diabetes, high blood pressures, sleep apnea, is the number one. This is the best weight loss surgery that we have. And I need to tell you that we are number one in the world in duodenal switch. So duodenal switch is not for everyone. It's only for patients that need a bigger tool. In duodenal switch, you need to take supplementation for life because the duodenal switch is the most aggressive surgery in weight loss surgery. And if you do your supplementation, you will not have no problem. But if you don't take supplementation, you can have malnutrition. Okay. So what we do in a revisional surgery after a gastric sleeve, we need to redo the gastric sleeve, remove the stretches areas, do a re-sleeve, and then reconnect the duodenum to the ileum, and that is the most powerful tool in weight loss surgery. So if you have a previous gastric sleeve and you need to lose a lot of weight and you don't have acid reflux, this is going to be the best option. The endoscopic sleeve. This is something that we do with high level technology. To be able to do suture with an endoscope needs a lot of technology, and we have it here in Mexico Bariatric Center. Probably here in Tijuana, we are the group with more expertise in ESG. We have almost 4 years doing ESG. And what we do is to shrink the stomach from the inside. We don't do incisions in the skin. It is a kind of surgery because we need to do sutures, but we don't cut anything. We introduce an endoscope through your mouth. We get inside of the stomach and we start suturing from the inside with not absorbable suture. The success rate is going to be around 20%. If your BMI is around 27 to 32, this could be a good option. This is designed for patients that they don't have a lot of obesity and they only need to do a few pounds. This could be a good option because recovery is only 2 days. This because we don't do incisions, we don't cut anything, we don't cut skin or muscle. So you only need a few days to recover. You're gonna be able to do exercise, to go back to work, and it's gonna be really easy to for recovery in endoscopic sleeve. But success rate is around 20%, and it's not for everyone. Okay. The gastric bypass to gastric bypass. Um, Gastric bypass has around 70 years in weight loss surgery field. At the beginning of the gastric bypass, I don't know, probably it's 50 years ago or 30 years ago, the bypass, it was a little bit different. Right now, the gastric bypass is not the same as the beginning. It has an it has an evolution. We understand better the weight loss surgery. We have more information, and this right now we are doing the current gastric bypass is a different technique. So sometimes we need to redo a gastric bypass to convert an old gastric bypass to a current gastric bypass. So we need to do a tune-up of everything. We need to go to the gastric pouch, to the anastomosis, and also to the reconnection of the small bowel. So success rate is around 50%. This is a big surgery because we need to understand previous anatomy and redo all the parts of the gastric bypass. And also, we have a lot of experience doing this procedure. Well, another option in after a Aaron-White gastric bypass is to do it endoscopically. We can resize the small I'm sorry, the gastric pouch and the anastomosis, the stoma, that is the connection between the gastric pouch and the small bowel. Normally has to be around 1.5 centimeters, but with the time it can get stretched. For example, if you have a gastric bypass 10 years ago, probably your stomach is gonna be around 6 centimeters, and you cannot feel restriction anymore. And we can do a revision with no incisions. That is a endoscopic technique. As the same as the ESG, the endoscopic sleeve, we can do suture and we can shrink the stomach, the connection, and make it back again as the beginning. So it's really, really recovery is really, really fast. We can only get inside of the stomach and the gastric pouch. We cannot go farther. So the revisional with endoscopic only give us 30% of success of weight loss. And this is because there are some parts of the gastric bypass that we cannot get access with endoscopy. We can only work in one part of the gastric bypass, that is the gastric pouch. But with this, we can do, um, we can go back to the track in the weight loss with this procedure. And this is one of the procedures that I like it more because we're having good results, and it's only 20 minutes procedure with a novel technique that is endoscopic suture. The gastric bypass to duodenal switch. This is the most difficult surgery in weight loss surgery. When I go to the bariatric meetings, probably there are only three surgeons in the world that are able to make this possible. You have one in Mexico Bariatric Center, and probably we are the team with more expertise. This is the technique that I'm gonna share in the next book around the world. The conversion of gastric bypass to duodenal switch is a really hard surgery, but sometimes when patient has an old gastric bypass and they need to lose a lot of weight, this is gonna be the only option. Success rate is around 65%. This is the most powerful surgery in weight loss surgery. This is a big surgery. Recovery is going to be same as all laparoscopic techniques. But yes, this is one of the most difficult procedures, and we are able to do it here in Mexico Bariatric Center. Mini gastric bypass to Aaron White gastric bypass. Mini gastric bypass is a one anastomosis. They only have one connection in the within the stomach with the small bowel, and sometimes patient can have acid reflux. This is a good technique for weight loss, but sometimes mini bypass can give you acid reflux symptoms, and we need to convert to traditional gastric bypass to improve acid reflux. So yes, this is an option that we can do. Um, this is something that probably we have 3 patients per week. Um, it's going to improve the acid reflux, and also we can do a reconnection to lose more weight. Okay, So if you have a mini gastric bypass and you have acid reflux, bile reflux, that is a little bit different. Bile reflux is harder than only acid reflux. So the MRI gastric bypass is the only option that you have, and we can do it for sure. Uh, as I'll tell you, duodenal switch revision, sometimes uh, in the time of history, in the history of weight loss surgery, um, all the technique has changed, and we can redo all the old techniques to a curing technique. Patients with previous 30 years ago surgeries, that is not the curing technique. We have to do a different technique. We can do it. And also we can do a revision of the duodenal switch and make it as a novel technique with a novel technique that is CDS. And we're having really good results because this is the most powerful surgery. The gastric balloon. Another option that we have is the gastric balloon placement. The gastric balloon is not for everyone. It's only for patients that is less invasive technique or procedure that we have. So the success of weight loss is not too high. And sometimes we need to remove the balloon and do a revisional and do a surgery. And we can do it. We have to do endoscopy first and then convert to a laparoscopic technique. We place balloons, we remove balloons, and also we can do all the procedures that of the gastric sleeve, every white gastric bypass, or duodenal switch. So it will depend on the needs of the patients, but yes, we can do it.
Well, thank you very much for
You're
taking
welcome.
time to explain all different types of procedures. I'm going to, like I said, release the Zoom poll. So please go ahead and take a minute to fill out the poll. And meanwhile, I'm going to just continue talking about financing. Um, we recommend, first look into the bank if you have good relationship with your bank and credit unions, and then look other places. We offer super money in our websites, e-financing, MediCard for our Canadians, and you can still look into SoFi and Lending Club and Lending Tree, all those, but do not apply for too many places at one time. It's going to affect your credit score. I mentioned about optional medical tourism insurance coverage. This is a great offer that we are taking by teaming up with the company that offers it in the world is number one. And we are offering this at $179. This is a great investment just for your safety, peace of mind. Take advantage of that. It's optional. Again, like Dr. Rodriguez mentioned, the vitamins after bariatric surgery, especially DS and bypass, is huge. We offer Emerge. We worked on this years to offer these different type of income, different shape forms like soft chew, chewable, drinkable, and capsule. And these are the ones you need to take after because it has a specific ingredient that your body needs after surgery. And this is made with the best ingredient according to the ASMBS standards. Okay, so we promise to be faster till we can get to your questions answered, specific questions. So Jennifer is asking, I have gastric sleeve 2 years ago in February. I started at BMI under 32. I got down to 26 and now I'm back at 30. Should I get a revision or should I use my tool and focus on diet and exercise? I'm 46 years old and have had terrible time losing weight on my own for the past 5 years.
Okay. The BMI is something important we need to know because we have different tools. The most aggressive tool is the duodenal switch. We recommend duodenal switch when BMI is higher in provisional surgery. I'm talking in provisional surgery is higher of 40. Sometimes when patient has comorbidities like diabetes, high blood pressure, sleep apnea, we can and BMI higher than 35, we can do a duodenal switch. But right now, your BMI is not too high, so we can go to RNY gastric bypass. It could be the best option for revisional surgery.
Thank you very much. So, what causes immediate hiccups from taking one bite of any type of food, whether it's a little bit or a small bite?
Um, the stomach is really small, and the stomach has nerves connection to the diaphragm, and that's why you can have hiccups. It's gonna be temporary, but it's something that we cannot. It's something part of the anatomy. It's not gonna be there forever, but the reason is because we manipulate the stomach and it has connection to the diaphragm. And another thing that we need to check if you have a hiatal hernia. If you have a hiatal hernia, can give you hiccup symptoms, and we need to fix the hiatal hernia.
What is the percentage of infection with revisions?
Revision has higher rates of complications because it's a more difficult surgery because we need to remove the scar tissue from the previous surgery, understand anatomy, and then redo the the surgery. And we need to use staples and suture where there was a previous staples. So non-revisional complication, non-revisional surgery has less than 1% rate, but with revisional, we can go to 3% rate of complications. It's higher, but it's not too high. And that's why you need to choose a real expertise surgeon to be able to do this.
Priscilla already asked a question. I think she's already scheduled for lapband to RNY, but she's asking, I'm worried about erosion on my band. Is that real common?
Well, it's not real common, but that's why we do an endoscopy during surgery when patient has lat bands. We need to do it before um, we get inside of the abdominal cavity with the laparoscope. So we start with endoscopy. If we see everything is okay, we can proceed with the surgery. Um, it's not real common, but if we found an abrasion, we have to remove the lat band, and we cannot proceed with the surgery because it's going to increase the risk of complication. We need to wait probably 3 months to be able to do the surgery, but safety is going to be always first, and it's going to be a finding. So that's why we always do an endoscopy before lat band removal or conversion to a surgery.
Patient asking, I'm 4 years post-op, post-gastric sleeve surgery with MBC. Is acid reflux a long-term effect after this surgery?
The 10, the 50, 15 to 20% of patients with gastric sleeve can have acid reflux symptoms. Uh, if you have 4 years and you still have acid reflux, the acid reflux is not going to improve. We need to think to fix it and do a conversion to urban wide gastric bypass. If you want to lose more weight, we can do a gastric bypass to to help you to lose more weight. If you don't want to lose more weight, we can only do the part of the acid reflux in the MRY.
Um, Amanda is asking, currently 338 pounds at 5'7". So a large amount of weight to still lose again. Yeah.
Yes, the best option when uh, your weight is higher than 250 or 250 pounds, the total switch is gonna be the best option.
If you have revision to DS, can you still experience acid reflux?
Yes, with the sleeve, with the duodenal switch, you can expect acid reflux because the only surgery that is an anti-reflux surgery is the Aaron White gastric bypass. That is the best technique that we have to improve acid reflux. And yes, there's always a chance with the sleeve or duodenal switch to have acid reflux.
What are the chances of having to get a hiatal hernia repair if you have long-term acid reflux?
That is something important, Ron, because sometimes the problem is the gastric sleeve that is too tight, but sometimes it is a hiatal hernia. If you have a hiatal hernia with the gastric sleeve, we can fix the hiatal hernia and fix the acid reflux. Another another way to say this is it's really important that your surgeon check if you have a hiatal hernia, and if he found it, he needs to fix it. Because if they don't fix hiatal hernia, you can have acid reflux with sleeve, with Aaron White gastric bypass, or with duodenal switch. So it's important that in all weight loss surgery, the surgeon checks if you have a hiatal hernia, because if they don't fix it, you can have a lot of symptoms with acid reflux.
My BMI is 34. I'm 5 foot 4 inches, currently weighing at 184 pounds. Would it be best for a revision for my sleeve surgery? I've gained 25 pounds over the last 2 years.
If you don't have if you don't have diabetes, high blood pressure, or any metabolic disease, the best option is gonna be the Aaron White gastric bypass.
Amber asked actually two questions. It says, I'm still unable to eat after being sleeved 3 years ago. I cannot eat a small amount of slider food, which is awful. I feel like as soon as I swallow anything gets stuck and then I immediately throw up. I've gained all my weight back also, and I don't drink anything but water and barely eat anything. And then she's asking for acid reflux, hiccups, and gaining weight. Should I go with DS?
Okay. It will depends of the weight goal that you have, but with this um, with this history, I believe the best option is gonna be the Aaron White gastric bypass, because you're gonna lose more weight, and all the problems that you have are gonna be fixed with the Aaron White gastric bypass. So I believe the Aaron White is gonna be the best option.
Okay, great. Amanda is asking, I had gastric sleeve in August of 2020, and since 23, have gone from 125 to 198. My lowest weight was 110. Very bad acid reflux for the past 3 years. What's the best surgery for me? Also pre-diabetic. I'm 5 feet 2 inches.
The answer is everyone white gastric bypass.
Okay, so it looks like we got everybody answered. Unfortunately, I couldn't get our presentation on Facebook Live, but this is going to be processed and audited, and we'll be ready for anybody who needs to watch it again. If you missed some information or you need to have somebody else watch this webinar, again, these are great opportunities for patients to get on and learn and use expertise that Dr. Rodriguez bring to our team. Really appreciate you. I'm waiting for the raffle so we could do the raffle like I promised. Again, if you have any other question, you can reach us. We're going to start do the live Surgeons Live on Wednesday and Saturdays. Saturdays, of course, the ones we have webinar. And I think we do actually, this is interesting for you to know, we would have a webinar for plastic surgery next week on the 25th, I believe, at the same time, 10 a.m. Pacific time. So if you guys are interested, you can sign up for that. So we would talk about skin removal, mummy makeover, all that. So let me see about, okay, so let's see.
And this is something really important because after weight loss, you need an plastic surgeon, but not a traditional plastic surgeon. Then you need an expert in after weight loss surgery, and you're gonna find it here in Mexico Bariatric Center. And it's totally different a traditional plastic surgery versus after weight loss surgery. So you need to find the correct plastic surgeon, and for sure we have it here in the team. So that's the difference of success when expertise when the team is expertise in what they are doing. So I need to go back to the surgery room. It's been a pleasure. If you have more questions, we always in contact with our patients. Uh, Email, messages, all the social media. We can answer all your questions, and we can have a talk later. Okay. Thank you so much for listening.
Okay. So we have the webinar winner's name, Jennifer Messer. I'm going to see about letting you talk so you can share your story. Jennifer Messer. I hope I didn't say. Are you with me? You can you unmute. Hi, Jennifer.
Hello. Hi.
How are you doing?
I'm doing great. How are you?
Great, great. So you're the webinar winner for $2,000 off of your surgery package.
Wow.
And you want to tell us more about yourself and about possible surgery, revisional surgery and all that?
Yeah, I'm the one that had my question was answered about my BMI. It was relatively low when I started, and I didn't really care about the amount of weight that I lost. I only cared that I had diabetes, sleep apnea, high blood pressure, And they just kept giving me more and more medication. So I went and got the sleeve, and I didn't lose very much weight. And I don't know if that was me, like I did something wrong, or maybe it was something with the surgery. I'm not sure, but I'm back up in my BMI to 30 now, and I'm like, and I only started at 31, so I was like, this is not a good trajectory. So I don't know what the best option is, but I was looking at potential for revision and seeing what could help, because I'm more concerned with my health than I am with the weight itself. And even at what would be considered low BMI, I have all these health problems. So
Yeah, that's why we mentioned about BMI and you know, obesity is a metabolic disease, and you know, all these health conditions are important. It's not just
yeah.
putting your numbers into a formula and giving you a number. Well, great. I mean, your HQ is going to be is always reviewed by the surgeon, and you
Okay.
can circle back again with your coordinator. We will reach out to you again and talk to you more. Make sure you know you're on the right track. Want to thank Dr. Rodriguez first of all, because he's a very busy individual. He's a scholar, and he takes time to do these webinars. I want to thank every one of you for joining us. I appreciate you taking your time with us this morning or afternoon from where you are, and hope to see you in the next webinar or talking to us. If you need something, call us. Thank you so much. Thank you, Jennifer.
Thank
Goodbye.
you.